This is the Heartland Daily Podcast.
Hi, welcome back to another episode of the Heartland Institute's Healthcare News Podcast. My name is Sarah Lee. I'm a healthcare policy advisor with the Heartland Institute. And if you are a regular listener, you know that on this podcast, we try to talk about healthcare from the perspective of the free market, particularly as we move away from sort of single payer or government run, I should say, healthcare programs like Obamacare, and move more toward more federalism in healthcare. The Trump administration is pushing that a little bit, letting states make decisions for themselves. And one of the issues that the Trump administration has been working on, or at least talking about, is the issue of surprise billing. And I have a guest on with me today who knows a lot about that issue. His name is James L. Martin. He is a retired veteran of the U.S. Marines, and he is the chairman of an organization called 60 Plus, the American Association of Senior Citizens. And what this group does, I'm going to let Mr. Martin explain it better than I can, but what they do is they're a sort of an alternative to the AARP. They look at some of these issues for seniors from a free market perspective, which, given this show, we like a lot. So, Mr. Martin, thank you so much for coming on today.
Well, thank you for having me, Sarah. It's an honor to be with the Heartland Institute.
Thank you. It's an honor to have you on with your background and your work on these issues. I know this issue of surprise billing is very important to 60 Plus, but first, before we get into that, tell me what 60 Plus is.
Okay, thank you for asking me that very important question. I formed, if you will, the 60 Plus Association some 25 years ago to give seniors another voice in the nation's capital other than the AARP. Normally you think of the Association for Retired Persons. Seniors have a vocal voice in the nation's capital, but much to my chagrin, I learned that the AARP leadership in the nation's capital comes from a very liberal point of view, big government, if you will. While most seniors out in the 50 states, I think, come from a more right of center, let's say a more conservative viewpoint. So I started 60 Plus to give seniors another voice. And let me just give you a couple other pertinent differences between the two. The AARP is a big government entity, a Fortune 500, if you will. It's huge and mammoth in size. It takes taxpayers' dollars, which is a matter of principle we think is wrong. We don't think that you should be using taxpayer dollars to promote a policy with which half the public may agree, half may disagree. We depend on voluntary donations from folks around the country who agree with our mission. Another major difference, they tout an entertainer, a great entertainer named Harry Belafonte. Harry Belafonte is so far to the left, he makes President Obama look moderate. We tout another great entertainer who comes from a conservative viewpoint, legendary singer Pat Boone. So that's another major difference between the two of us. Again, the major difference, though, is the AARP is a Fortune 500 business conglomerate making millions of dollars selling products to seniors while we're selling a philosophy. Less government, lower taxes, and an adherence to the Constitution of the United States.
Wonderful. I'm glad to hear that because I agree with you. I think that the AARP, they are almost like quasi-governmental agencies, aren't they?
They absolutely are. And again, if I could quote Thomas Jefferson, and no, I'm not old enough to remember that great president, but it was Thomas Jefferson who said once, to take taxpayers' dollars to propagate an idea that half the public may agree with and half the public may disagree with, he said, using some old-fashioned language, that's both sinful and tyrannical. And we say to the AARP, you should not be using tax dollars to promote a philosophy that the public may not agree with.
Yeah, that's really interesting, and I'm glad you brought up, the founder, one of the founders, because we sort of, as we, have been moving through this kind of philosophy of big government, the ideals and the values of the founders, we seem to be moving further away from that. Now with the Trump administration, there's a sort of a U-turn has been made. And I'm really glad that people are starting to talk about the values of the founders again, because they're good values.
Absolutely. So much so, and again, I carry a copy of the Constitution around in my hip pocket when I'm out talking to seniors around the country. I like to hold it up. And always in that crowd of seniors that I deal with, many others reach in and pull out their copy of the Constitution. So that's a very reassuring moment.
Yeah, I bet. So, so let's talk about healthcare then, from the, through the lens of maybe some of these constitutional values and certainly free market values. You wrote a letter, 60 Plus Association wrote a letter recently to congressional members that had to do with sort of letting them know that it was probably not a good idea for them to address the issue of surprise billing, which I'm going to ask you to define in a second, but that it was not a good idea to address this issue of surprise billing in healthcare through what are called price controls. So can you define surprise billing and price controls and give me an idea and our listeners an idea of what it is that you're warning congressional members not to do?
Sure, I'd be glad to. But first, let's be clear about one thing, that without question, something needs and should be done about the cost of prescription drugs and, in fact, about healthcare in general. Mm-hmm. But clearly, the business of price controls and surprise billing or balance billing is not the way to go. Let's mention price controls first.
Okay.
Nancy Pelosi, as Speaker, has put forth a plan that really is nothing but instituting price controls on all medicines. And she points, and the House Democrats point to foreign countries where they say their plan would allow the government to set prices, if you will, for medicines based on what foreign countries pay. But what they're not pointing out is that where governments set prices in these price controls, patient access is far worse than in the United States. Mm-hmm. And in fact, this type of policy could cost innovative pharmaceutical companies as much as trillions of dollars over the years. But on top of that, it has a devastating future implications for patients, primarily seniors, of course, but for all generations. But instead of setting price controls, drug prices, to save the government and health plans money, what we should be doing is looking for real solutions. Instead of price controls, we should be looking for real reforms that lower out-of-pocket costs. But here's what we need to do. You need to require insurers to share the discounts that they're negotiating on medicines. And this is the crux of the Pelosi plan. They want to set price controls. What they're doing, quite frankly, is they're bailing out big insurance companies. These big insurance companies negotiate with pharmacists, but instead of passing those savings along to seniors, they're pocketing those savings. And again, it's big insurance, if you will. But overall, I like to say that the good news is that insurance is currently affordable for most seniors, but the bad news is that big insurance is threatening seniors with higher premiums in the future unless Congress enacts price controls. And I got to tell you, we had a panel of experts here in Washington not too long ago that talked about price controls. These were panelists from about 8 or 10 different countries: Austria, Germany, Canada, if you will. In fact, I'll quote John Adams, Best Medicines Coalition from Canada. And he says that patients in Canada and many other countries are deprived, I'm quoting him directly, they're deprived the opportunity to be treated with the most advanced medicines because of their healthcare system in Canada. What I'm trying to point out is the waiting period in these countries, in foreign countries that set prices for medicines, patients have significantly worse and slower access to innovative medicines. The point being, let me give you just one in particular.
Okay.
A cancer drug. There's for cancer drugs that are available in these other countries. Here in the United States, you have access and you need access. There's as long as an 18-month average waiting period from the time they're available in the United States till they're available in these other less developed countries. And everybody keeps saying, oh, let's import from Canada. The Canadians are saying, no. I mean, Canada is a very small country in comparison to the size of the United States. And if we started importing drugs from Canada, which I don't think we should be doing because of the safety factor involved, that would deplete the drug system. It would devastate the drug system in Canada. It's that clear. And by the way, before people say, oh my heavens, a safety factor, what do you mean? Well, 4 FDA commissioners, two under Democratic presidents, 2 under Republican presidents, 4 of them have all come out in unison against importation because of the safety factor. You don't know what's in these drugs at the time that are being imported.
Well, I know that in Florida, I think Ron DeSantis and I want to say the Trump administration have encouraged some of this. And, just as a sort of a quick fix. What do you think about that? Have you heard about that?
Oh, absolutely. And I'm sorry. I think the president and the governor of my home state, Florida, have been sold a bill of goods. And I think it started with the Health and Human Services Secretary, Alex Azar. By the way, he was calling these imports a gimmick at one point, but I think perhaps he got called on the carpet into the White House by an outstanding president, by the way, whose ideas I'm agreeing with more than 90% of the time, but this is one where I disagree with the president on drug importation.
Yeah,
because again of the safety factor.
Right, and I do think, and I'm with you. I generally have liked what the administration has done in the healthcare space, but I think on this one, they're not desperate. I don't want to put that spin on it, but they really want to address this issue of the cost of prescription drugs, and so they're sort of floating these trial balloons to see what people think. And I think it's up to groups like yours and certainly people like me who work in, research regarding healthcare to come up with some ideas that are not price controlled. So with that said, what do you think can be done to address the cost of prescription drugs if it's not price controls?
Well, I think let the marketplace work its magic, if you will. We've got the greatest healthcare system in the world, bar none. Yes, we have to bring down prices, but this is clearly not the way to do it for lots of reasons. But again, if I may, let me just point out to you once again, if you will, the fact that the drug system that Nancy Pelosi and the Democrats are proposing will dry up, if you will, funding over the long haul that is needed by the pharmaceutical industry. And by the way, if you socialize the pharmaceutical industry by taking away the incentive to innovate, that's going to lead to a lower quality of life, a shorter lifespans for senior citizens. It's going to limit access to these life-saving medicines, therapies. I've stopped using the term drugs because of the opioids crisis that we're going through in this country now. I'd rather say life-saving or life-enhancing medicines or therapies instead of drugs.
Okay.
But in the long run, it would dry up investments that produce the next generation of life-enhancing medicines. By that I mean it would dry up the funds that are needed for research and development. And by the way, R&D is the way to go. Research and development funds, and just so people have to understand that this is not a simple process that the pharmaceutical industry is involved in. The only reason that we have these innovative therapies coming onto market is because manufacturers are able to invest time and money into the research and development, R&D, if you can. And again, this is especially important to seniors whose quality of life is often governed by this access to these wonderful therapies that have been developed. But let me just read you one statistic that is really an eye-opener. On average, it takes more than 10 years to bring a new drug to the marketplace. But out of all the experimental drugs under development, 90% of these, Sarah, never come to market. They do not receive approval by the FDA, so they don't come to market. So you've got millions and billions of dollars in research and development of drugs that never come to the market. Just take one, Alzheimer's. If you got more than 150 Alzheimer's therapies that have been tried over the past 15 or 20 years, none of them have come to market yet. But despite that, the pharmaceutical industry continues trying to find a cure for Alzheimer's. And thank God that they are trying. Mm-hmm. But these are not, and by the way, I'm not defending the pharmaceutical industry. In fact, I'm praising the pharmaceutical industry. Mm-hmm. And there's room for brand drugs and generic drugs. They both have a great place in our system. But if I had to make a choice right now, you have to have brands. It's like what comes first, the chicken or the egg? Right. Without brands that lead to, and a great, two great members of Congress, I hate to get on my soapbox here, but okay. A liberal Democrat, Henry Waxman of California, and a conservative Republican Senator, Orrin Hatch of Utah, put together the Waxman-Hatch Act some 40 years ago, mm-hmm. which has led to many more generic generic medicines being on the market right. for and more affordable for seniors.
Right, and that definitely helps control costs. We talk a lot about that here at Heartland, and the Trump administration has done great work on trying to, get more generics approved and on the market. But back to surprise billing or balance billing, in your letter to the congressional members, you make the point that the big insurance lobbying campaign to Congress, their argument for price controls, and I'd like for you to comment on this, is that if they don't get the price controls, then insurance premiums will skyrocket. Is that true?
That's their scare tactic, and they'll blame it on Congress mm-hmm. Instead of themselves. They clearly are trying to protect their own pocketbooks, and but where these insurance companies and everybody else in the healthcare industry, hospitals, medical providers, they got to work together to try to hold down costs. But the fact is, it's a matter of big insurance again, and I'm picking on big insurance here because they could be passing along. Have you seen the TV ad? I think AARP is running where the guy is saying, "Yeah, we're an insurance company to this lady is on the phone, obviously a senior citizen." He said, "Yeah, we've just now cut back some prices here. We've saved a lot of because we've negotiated some prices here. We really cut back on costs." She said, "Oh, you're going to pass that along to me?" And the fellow looks a little bit distraught and he slams down the phone. We're saying that yes, those discounts should be passed on. In fact, members of Congress have offered. I think Congressman Arrington of Texas on the Ways and Means Committee, he's introduced an amendment that would provide seniors with this type of direct relief at the pharmacy counter. He's not talking about price controls or higher taxes or government control. He's just talking about when you have these negotiated discounts, they should go, guess who? To who? They should go to senior citizens.
Right.
It's that simple. And again, I don't want to get in too far into the weeds on this surprise billing business, but the fact is they have what in network or out of network. When an insurance company, when a senior goes in and gets a procedure and all of a sudden gets this huge bill, and they're told, well, you're not in network. Well, how in the world is a senior supposed to know that when they go into a hospital? They paid into Medicare, SFI, all 50 some years now. Still paying in, by the way, seniors still pay in through the taxes that are taken out of their Social Security benefit every month. But seniors have paid into this system all their lives, and they go in and expecting to get the care that they paid for, and then they're hit with what's called a balanced billing, they like to call it, but it's a surprise bill, a huge bill. And the fact is, they don't know that when they go into the hospital, whether they're so-called in-network or out-of-network. Right. It just really is a traumatic experience in many ways for so many seniors. We're saying there has to be a stop put to that. And the biggest point that I can make is that price fixing is just going to have a devastating impact on seniors of all generations. And again, I can't emphasize more. By the way, when you get to Medicare for all, this cockamamie idea that's being proposed by Ocasio-Cortez, but not only that, Elizabeth Warren and Bernie Sanders and everybody else, I think what Speaker Pelosi, quite frankly, has done is she has caved in to the socialist wing of her party.
Yeah, it looks like it, doesn't it?
It's shameful that she's done that, but that's what she's done. It's surely not it's not the answer, but she's surrendering, kowtowing, if you will. I want to say the radical socialist wing. Some dare call it the communist wing of the Democratic Party, and that's a shame. Mm-hmm. But this plan of drug control, drug price fixing, actually hammers Medicare, takes a sledgehammer, if you will, to the Medicare system at the expense of patients, primarily seniors, but all generations. And also, it's at the expense of the innovators in the free enterprise system.
Right.
It actually puts our healthcare system, again, as the finest in the world, on a pathway toward the Ocasio-Cortez, Bernie Sanders, Elizabeth Warren's socialized medicine. And by the way, I saw on television today, she says, stop saying we're offering free stuff. Well, if you say we're offering you tuition-free college, then that means it's free.
Yeah.
But of course, that's not really free. It just means that it's coming out of somebody else's pocket.
Well,
and that's socialism, and that's wrong.
Yeah, they've backed off. They back off on that when they need to. I saw that Bernie just yesterday was talking about how he's going to raise a 4% tax on any income over $29,000 to help pay for Medicare for all. And he flat out said, no, healthcare isn't free. So they offer free things until they're forced to admit that it's not going to be free.
It's not free, that's for sure, yes.
Right. Okay, well, thank you so much for coming on. This has been interesting. There is some worry that they're going to try to include this surprise billing price control fix in the budgetary bill at the end of the year. Have you heard anything about that?
No, but we've got our eyes and ears open. We have our friends on Capitol Hill that keep us alerted to those things. And by the way, on behalf of the 60 Plus Association, the conservative alternative, if you will, to the AARP, we have over 5 million senior citizens around the country who believe in our right of center, less government approach, if you will. These are senior citizens who rose up in arms back in 2009, 2010 when the so-called Affordable Care Act was being passed. They were up in arms about it. And as a matter of fact, Sarah, you may remember this, after it was passed, the AARP, they discovered some emails from the AARP that were being sent over to President Obama at the White House saying, our seniors are not buying into this. They are voting 14-1 against your proposal. We've got to change our messaging. And clearly the AARP has a financial interest in this. They have cornered the market on supplemental insurance plans. So when you see them out there saying, hitting away, say, at the pharmaceutical industry, they're really protecting their own pocketbook. They're selling insurance around the country. And I can't fault them for that, but the fact is, Sarah, with the fact that they made $600 million in profits last year, a lady down in North Carolina asked me, my heavens, I thought they were a nonprofit. I said, well, that is kind of puzzling sometimes how a nonprofit profits to the tune of over $500 million. They do it selling premiums to seniors.
Right. That's always interesting. Sure, it's a nonprofit, but they brought in millions of dollars. It's hard to explain that one. But on that note, I'm really glad there's an alternative to them in your organization, 60 Plus, American Association of Senior Citizens, saying that name again. Is there a website that people can go? Do you have a website people can go to learn more?
Yes, we sure do. It's 60plus.org.
Okay.
And have them visit us and join up. Again, we do not demand donations from you voluntarily. That's how we thrive on people who believe in our approach to government. And one other note I'd make, unfortunately in this town, I came here as a newspaper reporter when John Kennedy was in the White House, but the Democratic Party believes that government is the first resort. And the Republican Party looks at government as the last resort. Yes, we're all our brother's keeper, but you don't always have to go strictly to the government. Ronald Reagan once said, they say government is the solution. No, President Reagan said government is the problem.
Right. Well, thank you. On that note, that's a great way to end it. Thank you so much, Mr. Martin, for coming on. This has been very interesting. And if it's okay, as this moves forward, I'll reach back out to you. Maybe you can come on again and update us.
Thank you so much, Sarah. I enjoyed it.
Thank you. And as always, you can find our work at heartland.org, or you can follow our healthcare policy on Twitter at HCPolicy. Thanks, y'all, and we'll talk again next week.
Are you interested in helping the freedom movement? Are you interested in helping the Heartland Institute? Then consider selecting the Heartland Institute as your Amazon Smile charity of choice. Amazon's charity will donate 0.5% of your purchases to the Heartland Institute without any additional cost to you. And believe us, every little bit counts. Visit smile.amazon.com and type in the Heartland Institute to get started today.